Hi guys, this is David Villar and welcome to this first video on toxicants that affect the GI tract. On this presentation we discuss brassicas, castor beans and rumen indigestions. And I'll begin by saying that the number of things that can cause direct damage to the GI tract is countless. Obviously some toxicants can affect other organs and indirectly affect the GI tract. So if we start by talking about brassicas, these include many plants that are common vegetables, as you probably all know. They are in the cabbage and the mustard families. Some common ones are broccoli, cauliflower, turnips, cabbage, kale, rapeseed, Brussels sprouts. On the slide we see a field of mustard with the typical seed pods that are known as siliques, which are pressed close to the stem. And the flowers are yellow and arranged in a cluster with 4 petals each one. The toxic principles are glucosinolates and their breakdown products. If we look at the structures, they are glycosides, and the aliquins can yield 4 different types of compounds that are listed here, starting with epithionitrile, nitriles, thiocyanates, and isothiocyanates. It's kind of complicated to say those words. The isothiocyanates are very irritating and will cause a gastroenteritis. The thiocyanates are goitrogenic and they cause thyroid enlargement. And the nitriles are the ones that are really toxic for the liver. These glucosinolates are important defense mechanisms against insects, and they are kept in cells that are isolated from those containing myrosinins, which are the enzymes that will hydrolyze them and convert them into the active principles that we just mentioned. And they are also listed here. Let's say them again: isothiocyanates, nitriles, thiocyanates, and epithionitrile. There needs to be some damage to the plant to put in contact the enzyme with the glucosinolates, and this could come from insect damage or also by the mastication and ingestion by herbivores. Here is a case of an acute mustard toxicosis in beef cattle. The history is that the previous day the neighbor had dumped 400 barrels of moldy mustard seed onto a ditch that was adjacent to the pasture, and the following day there were 6 dead animals, 2 sick ones, and 5 had aborted. The necropsies show severe edema throughout the GI tract, particularly in the serosal surfaces, and when they opened up those rumens there were large amounts of seeds, and the epithelium was brick red in the rumen and the reticulum, and basically the contents were just dark brown, mushy liquid looking, obviously by presence of blood there. The isothiocyanates, which were actually the cause of the gastroenteritis, were measured in those GI contents, and they were very high. And the fact that the animals did not show a hemorrhagic diarrhea was likely because all the seeds were still sitting in the rumen and had not moved on past the intestine. So based on what we just saw, do you think we could introduce a group of cattle into a field of rape or sugar beets? If you look at this slide, they are in fact turning those cattle into a field of rape. So the answer is neither yes or no. I would just say that they present both interesting opportunities but also some challenges. We can never for sure allow them to ingest 100% of the diet as only rape or sugar beets. We could turn them, if they only are going to ingest between 60 and maybe 70% max of the diet, and the rest will have to come from grass, hay, silage, or any other type of forage. We should also slowly transition them to eat those rape leaves and in about 10 days, because otherwise they could either bloat, and the rumen, as you probably all know, needs to be adjusted slowly when there is a change in diet, as we will see later, because otherwise we make them prone to either bloat or develop an acidosis by excess carbohydrates. Most of the brassica species have very low content of fiber, but they are very high in carbohydrates. They provide up to 60% of the total digestible nutrients, and up to 20 to 30% of the dry matter content is also crude protein. So this is almost like feeding them with concentrates. Now, apart from the glucosinolates, there is another toxic principle, which is a hemolytic agent, and it's called S-methylcysteine sulfoxide. This one would be the one responsible for the hemolytic anemia that happens after several weeks of continued ingestion. This is an amino acid that is also present in garlic and onions, and in some brassica species it can reach up to 4 or 6% of the total dry matter content. So as we see in this figure, when it reaches the rumen, it becomes converted to dimethyl disulfide, which is the actual active principle that will oxidize hemoglobin. On this other slide, we see what happens in the red cells. The dimethyl sulfide will be detoxified by reduction with glutathione and become converted to two molecules of methanediol, which is non-toxic. Obviously, with too much of the toxicant, the detoxifying mechanisms in the red cell will be overwhelmed, and the hemoglobin will be oxidized and converted into Heinz bodies, which are destined for destruction. So the ultimate outcome basically is a Heinz body hemolytic anemia. And as we see at the bottom, the degree of the hemolytic anemia in experimental studies, this was done with sheep, is actually dose dependent. Lower doses of 50 to 100 milligrams per kilogram of the dimethyl sulfoxide. The anemia is mild. It is moderate at doses between 100 and 150 milligrams per kilogram, and severe at doses between 150 and 200 milligrams per kilogram. So let's see what different syndromes have been associated with brassica toxicosis. They should be, as I said before, particularly suspected when the animals are fed only with brassica crops. As we just saw, one of them is hemolytic anemia with Heinz body formation in about 2 weeks of exposure, particularly with kale. Gastroenteritis due to the irritating effects of isothionates. These two effects are probably the most often noted. Goiter, that can cause reduced growth or poor reproductive performance. This is caused by the thiocyanate, which blocks the tyrosine iodination, and basically there is no production of T4. This will happen probably after many weeks or months of ingestion. Another one is pulmonary emphysema, also known as acute respiratory distress syndrome. The brassicas can contain a lot of a high concentration of tryptophan, which, as you know, is an amino acid, and in the rumen is converted to 3-methyl-indole, which binds proteins in type 1 cell in the airways, and that results in the acute pulmonary edema and emphysema at least 1 week of ingestion. The photosensitization is associated with hepatocellular toxicity, and the polyencephalomalacia would come from a high sulfur intake with the brassicas. Now, there are quite a few cases reporting secondary photosensitization in cattle that were moved to fields with a cover crop of brassica turnips or rapes. As I say, there are quite a few, most of them described in the US, South Africa, Australia, and New Zealand. Turnips may be the best grazing option available in late fall and winter in the US, but unlike everything else, they can cause problems. So these may all sound kind of scary, but most problems are quite rare actually, and they can be reduced or eliminated with careful management. So that's why I brought here this newsletter from the University of Kentucky. They provide some recommendation for the safe use of brassica species as cover crops. The first one is not to shift cattle onto turnips suddenly. Another one is to adjust cattle by feeding high quality hay or pasture for a couple of weeks before grazing turnips. That way we prepare the rumen for the high protein and energy in turnips. Another one is to give them just a few hours access to turnips at the very beginning. Also make sure that they have access to a dry forage like corn stalks or a palatable hay. Basically, just not allow them to fill their rumen with more than 70% of the total ration. Strip grazing is a method that will force cattle to eat both the roots and the tops. Another recommendation is to plant brassicas with grass species as a cover crop mixture. Basically, the grasses provide the dry matter and the fiber and help balance the diet. So interseeding with grasses is always a better option than using a pure stands of any brassicas. And finally, we have to say to farmers that they should not be afraid to graze turnips if they can manage them carefully. So this other case took place in South Africa. It was a herd of 400 Holsteins that were turned suddenly to a field of turnips that had been planted 45 days earlier. After 3 days, 20 cows had very sensitive and painful teeth. That is what the photo on the right shows. There is reddening, erosions, and crusting on those teeth. On day 6, there were an additional 30 cows that were affected with additional signs in non-pigmented areas of the skin. And the photo of the muscle shows the erosions, the ulcers, the fissures, and the crusts around those nostrils. Some of the cows had severe sloughing of extensive areas of non-pigmented skin, and they had to be culled on humane grounds. This is what we see on the withers and the dorsal thorax of the image. If we look at some of the liver enzymes, the values were elevated, which is an indication that the photosensitization was secondary to the liver damage. For example, if we look at the first one, GGT, the elevation is more than 10 times above the normal range. And they mentioned that the cows were removed from the forage on day 4, and by day 13, no new cases were seen in the herd. On the discussion, they mentioned that turnip crops have been used as fodder for numerous years in dairy farms without any complications. The problem here is that the cows had a very rapid ingestion instead of an incremental or gradual ingestion. So using techniques like strip grazing with properly secure fences is always a good idea. And to prevent this from happening again, they recommend to provide hay or silage so that the cows will have the opportunity to fill their rumens before they begin on the brassica crops. Ideally, they want to ingest only like 2 kilograms of dry matter per cow the first days, and you can increase that gradually to 5 kilograms over the next 2 weeks. And that's what they basically emphasized on the discussion. Now, the next toxicant is the one present in castor beans. This is a native plant to Africa, but it can be found anywhere around the globe. It's very easy to identify in ditch banks, roadsides. The leaves are very large. They are palmately divided with many lobes and that have serrated leaf margins. The flowers are borne in panicle clusters, and the seeds actually, if you look at them, look like engorged sticks or beans. And they are actually inside a spiny fruit, which is often red as we see here. Now, the toxic principle is called ricin, which is a protein in the group of the toxoalbumins. These are really toxic compounds. The ricin is water soluble and therefore is not present in castor oil, and it's very heat labile, and therefore it's inactivated or destroyed when you prepare, for example, a castor bean cake, meal, or whatever product was subject to heating. It is probably the most toxic compound of any plant origin. The LD50 in rabbits is only 40 micrograms per kilogram. So if we think that anything below 5 milligrams per kilogram as being extremely toxic, this is almost 1,000 times lower. So there is really no word to describe that level of toxicity. In humans, 3 seeds can be lethal. In dog, maybe just 1. And the mechanism of action after it penetrates the membranes is by inhibition of protein synthesis. after inactivating those ribosomes. Basically, the protein has two chains. One is to facilitate endocytosis, and the other one to cause cell death by inhibiting the protein synthesis. Now, here is a paper that reviews cases of castor bean ingestions in 98 dogs reported to the Animal Poison Control Center in a period of 11 years. Obviously, how many beans were ingested were most of the time not known, but they say that only one bean is enough to cause clinical signs in a dog. And the most commonly reported clinical signs associated with the castor bean ingestions are listed in this table. The first thing is to highlight that 99% of the dogs died, and 3 of those had to be euthanized. The signs in this list most frequently develop within 6 hours following the ingestion, but that range from half an hour all the way up to 42 hours, and the duration of signs was from 1.5 to 5.5 days. Now, if we look at the signs and their frequency, starting at the top, the GI tract is obviously the main target organ. Vomiting in 80% of the cases, depression in 45, diarrhea in 37, diarrhea with blood in 24, abdominal pain in 14, anorexia in 16, and vomiting with blood in 10%. They explained that the low number of animals dying was probably because the ricin is poorly absorbed in the GI tract, and the beans need to be chewed up to release the toxin. So if they were swallowed whole, they would probably not be toxic. Here is a case of castor bean poisoning in cattle. It happened in Brazil, and the clinical signs appear within 6 to 24 hours after the animals were moved to a riverbank that was invaded with castor bean plants. There were 60 animals at risk, and 16 became sick, and of those 14 died. So the signs in 5 animals were basically of apathy, drooling, congested membranes, abdominal pain, watery and bloody feces, weakness, ataxia, and they say that those signs basically progressed to severe depression, recumbency, and death within 47 to 72 hours of the onset of signs. On this slide, we see an animal taking down the scrubs and consuming those leaves and fruits. The figure on the lower right shows the contents of the abomasum that were basically nothing more than brown, blackish liquid with seeds of castor beans. That they say that mucosa was bright red with swollen folds. And on the left image, we see the hemorrhages in the mesentery and the serosa of the intestinal loops that were filled also with hemorrhagic fluid. So the diagnosis is pretty straightforward if you see these lesions together with the seeds in the digestive tract. In the discussion, they say that poisoning happens in prolonged droughts, which make the animals very hungry, and they are basically forced to consume the plant. So next we're going to see one of the most common intoxications in cattle, which is an excess of carbohydrates that is going to cause a lactic acidosis. A good example would be ingesting whole corn kernels, or particularly if the rumen is not accustomed to eat large quantities of corn. Another source would be wheat, barley, or any other cereal grains. And this slide shows what the normal ruminal pH is of about 6.5. And if they ingest too much foods with high carbohydrates, there will be an increase in Streptococcus bovis that produce lactic acid, and that is going to favor the proliferation of bacteria that are gram-positive, like the lactobacillus, that produce even more lactic acid and lowers even further that pH. Now the protozoa and the gram-negatives will die at the lower pH, and at that point the rumen motility also stops, and there will be a corrosive damage to the rumen walls by that lactic acid. So when the rumen pH gets below 5, the consequences are basically the proliferation of lactobacillus and streptococcus. the protozoa and the gram negatives disappear, and the lactic acid lowers the pH and causes ruminitis with destruction of the rumen papillae. And when the acidosis does not kill the animal and is just borderline toxic, there will be bacteria like Fusarium necrophorum that enters the portal circulation. It gets to the liver and produces abscesses, which are usually found in animals that go to the slaughterhouse. Another consequence of the lactic acid is to increase the osmolarity of the rumen, which draws water inside, and the animal becomes dehydrated. And when there is a lower blood flow to the extremities, the animal develops laminitis with overgrown toes. Once that pedal bone sinks into the corium of the sole, it's never going to regain its original position, and basically the affected animal will have to walk with a lot of pain and discomfort for the remainder of its life. Now, the other thing that animals show because of the excess water going into the GI tract is diarrhea, and we also mentioned abdominal pain due to the ruminitis, which is manifested by the animal kicking its belly with the rear legs. So we can divide an acute acidosis into a simple one in which the animal recovers in 2 to 3 days of the exposure, and then a severe one that will kill the animal. So in simple acidosis, the animal will exhibit belly kicking, as we see on the top image, anorexia for several days. Diarrhea is a very common sign in 12 to 24 hours, and the absence of ruminal movements. The same signs will be seen with severe acidosis, but on top of that there will be ataxia, recumbency, that can look like a hypocalcemia syndrome. The animal will have an elevated heart and respiratory rate, severe dehydration with sunken eyes and dry mucous membranes. And some of these signs, like the diarrhea, may not be seen if the animal dies in a few hours from the ingestion. So the diagnosis basically relies on the clinical signs. We want to auscultate that rumen to see if there is a lack of movement. If we could take a sample of the rumen and do a pH, it will be below 5. And if we do a gram stain, there will be more gram-positive bacteria and a lack of protozoa and gram-negative bacteria. On a healthy rumen, there should always be more gram-negative bacteria instead of gram-positive ones. Now, for mild cases, there is no need to replace that ruminal microflora from a healthy animal. So giving just magnesium hydroxide is going to counteract the lactic acidosis, and that may be enough. Obviously, the source should be removed from the diet and replaced with a good quality hay or forage. And a good drug for abdominal pain is Banamine, which, as you know, is flunixin meglumine. For severe cases, there is no substitute to empty those ruminal contents and replace them with those from a healthy animal. If that is not an option, you can go with activated charcoal that will bind some of the gram-negative endotoxins and prevent their absorption. And as far as parenteral treatment, sodium bicarb, IV obviously, will reverse the metabolic acidosis, and it should be combined with a balanced electrolyte solution to rehydrate the cow. So, for example, a 10% dehydration on an average weight cow will need at least 60 liters, or what's the same, 15 gallons, to restore that blood volume. And just as for the mild cases, a good analgesic drug is Banamine. Now, to end the presentation, many times when a cow dies, it will bloat, and we don't know whether the bloat took place after the animal died or prior to dying. If it is an acidosis that killed the animal, they could bloat because the ruminal stasis, but not all the animals are going to bloat with acidosis. So a way to find out if the bloat was ante-mortem is to look for the bloat line. On those couple of images, we see a very sharp line of demarcation between the caudal and the cranial esophagus. The caudal area is pale or blanched, and the cranial one is very, very congested. And the best indication that the animal died from acidosis, as I just said, would be to measure that rumen pH on a dead animal. It's usually going to be below 5. And as we just mentioned, doing a gram stain is also another test that can throw a light in these cases. So this is the final slide, guys. On the next video, we'll continue talking about other toxicants that affect the GI tract. So until next one, take care and bye-bye for now.